Hi, in this unit we'll discuss sutures and the removal of sutures. Now, sutures are also known as stitches. They're used to close up wounds, whether it be a surgical wound or some kind of accidental wound. There are different types of sutures, many different types of sutures. But the most common suture is the simple interrupted pattern. That's mostly what we would see in sutures that would be requiring removal over a period of time. So not all sutures do need to be removed though, because some are made from material that dissolves in the skin. Based on the location, the depth of the wound, we would have sutures remaining for a week or maybe up to 2 weeks. And then they would be indicated for them to be removed. You're going to look at the order that's given, or if it's a verbal order, pay close attention to be able to determine what would be needed. So you explain the procedure to your patient, be sure that they completely understand what's going to happen, that it shouldn't be a painful procedure, but it can be uncomfortable because the stitches are actually embedded in the skin and they need to be manipulated just a little bit so that you can cut them and remove them. So if they're on pain medication, you may want to ask them if they have recently had, or if they would like to get some before or after. It's not at all necessary, but in some cases we may want to just check up on that. So you gather your supplies. Before, we discussed opening your sterile tray, which we already have open here. Your tray, in the case of removing a suture, needs to have 2 essential items: a tweezer and a pair of scissors, or in some cases we would use a blade. We also want to pay attention to different types of blade. For removal of suture, we would more want to use this. The head of the 10 is wide, which can cause us to cause injury to the patient. Based on our location and availability of equipment, that is what we may have to use to remove sutures. There's also the debate about sterile gloves versus clean gloves. Some practitioners remove sutures with clean gloves. It is not wrong. However, you as a student are required to use sterile gloves and a sterile procedure for removing sutures. So we go through the process of washing your hands, just like we did in the video, which would be linked below. And then you're going to observe the patient. Observe the wound. You want to look for, can you come closer to this? You want to look for stitches that may already be pulling out, that may have a little opening on them. You want to look for anything that might be red or swollen, or if they have any discharge. And then when you get to touch the wound, you want to touch it and feel if it's hot or if it's hard. All of these things would need to be reported to the physician before you start to move. So you would open your tray like we did in the previous video, which would be also linked below. Don your gloves. In this case, we're using sterile gloves. And then we do the basic cleaning of the wound. So we would have our clean hand versus dirty hand. You go ahead, you soak your cloths, and you make sure that you're prepared. You gently wipe your wound and discard. Wipe your wound and discard. You may want to dry your wound, because we want this to be clean and dry in order to do this process. So when we're removing the sutures, we are looking at it, counting all the sutures, ensuring they're all intact. You are going to pull on the suture and you are going to cut the portion closest to the skin. Now, if you notice, I've pulled up, but I still did not cut on this side. The reason that I didn't do that is because this is dirty material and I don't want to be pulling that through the skin. That is exposed, so it's dirty. So we're pulling the piece closest to the skin and then we're pulling it across. We don't want to pull out, we are pulling it across, and then we save our sutures because we're going to count how many we are removing. So we've removed one, we're skipping one, we're removing the other. Now, in some cases, it may be a little bit more challenging because white blood cells tend to make very good glue for skin. So we're doing every other suture. Why are we doing every other suture? We want to make sure that we do every other suture so that we're paying attention to the wound itself. Is it staying closed? Is it pretending to open? What exactly is happening here? Because if we remove every other suture and we realize that the wound is starting to pull open, we want to also advise the physician. Now, a wound like this with alternating sutures removed would most likely be one of the deeper wounds that would be located somewhere on an abdomen or a thigh or some large area. Wound dehiscence, similar to this, where stitches are pulled open, can occur due to sudden movement, premature removal of sutures. It can simply be just a malfunction of the suture itself. So in order to prevent something like this, we do the alternate removal of sutures. We see how the skin is handling it. If you realize that the skin is pulling apart when you've removed a suture, you want to advise the physician before continuing with your process. So when you're at the point now where you've finished with it, if there's any small amount of seepage, you may want to just give it a little clean. Go ahead and you also give it a little wipe. Now when you're finished with giving it that wipe, you may or may not use Steri-strips. They may not be available in the institution, but Steri-strips go directly across. They look like little pieces of tape that go directly across the wound. We want to make sure that they have maybe like a 3/4 inch on each side of the wound. So the Steri-strips would cover, and then we would either leave the wound open or dress it as is indicated. When you're finished with your dressing, if that is what is indicated, then you want to educate your patient. Educate them on the signs and symptoms of infection, how to care for the wound. Sometimes they may not be required to come back in for dressing, but they still may need dressing done. So you will explain to them how to do that. Explain to them what to expect. Explain to them the proper use of pain medication if that is what they need. Advise them when to contact the healthcare provider. After you finish with all that, you can go ahead, you gather your equipment, remove your gloves, and put everything away as you are supposed to. So that is your unit on removal of sutures. See you soon.